Hi there. Thank you for visiting the Children's Emergency at KK Women's and Children's Hospital. Your child has been diagnosed with febrile seizures. In this video, we will help you learn more about febrile seizures and answer your questions on how to care for your child. What are febrile seizures? Febrile seizures are seizures which usually occur with fevers, especially when the fever rises rapidly above 38 degrees Celsius. They are common and typically occur in children aged 6 months to 6 years old. However, studies have shown that there is no association between the height of temperature and the occurrence of febrile seizures. What happens during a febrile seizure? When having a seizure, your child may have the following symptoms: stiffening and jerking of arms and legs, up-rolling and blank staring of eyes, and clenching of teeth. Such seizures can last for up to 5 minutes. After a febrile seizure, your child may be sleepy and tired, but should be arousable after about 15 to 20 minutes. Should I be worried if my child has a febrile seizure? Many parents worry that febrile seizures will cause brain damage or delay in their child's development. Don't worry. A febrile seizure alone, if it is short and not caused by a serious illness such as a brain infection, does not cause permanent harm. In fact, you may even have a history of such fits in the family. Some parents also worry about the risk of epilepsy, which is a condition in which a child can have recurrent seizures. The risk of epilepsy after simple febrile seizures is less than 2%, which is only slightly more compared to the general population. So what should I do if my child has a febrile seizure? Well, the most important thing to do is to stay calm. Do not panic. Place your child on his or her side in a safe spot. Keep the head and neck straight to help breathing. Wipe away any secretions outside the mouth to prevent choking. Many parents worry about their child biting the tongue and thus try to put objects such as a spoon or even their own fingers into their child's mouth. Remember, biting the tongue is not dangerous to your child, but inserting objects may harm his or her mouth or teeth. Thus, do not put objects into your child's mouth during a seizure. In addition, do not attempt to feed your child medication when they are having a seizure. If possible, take note of the time when the seizure started. How do I care for my child at home? Remember, with common viral infections, fevers will rise and fall. You can give medicine for fever to make your child more comfortable. However, this will not reduce the risk of another febrile seizure. When your child is sick, monitor his or her general condition. Many children look unwell when the fever is high. However, in minor illnesses, most will return to normal activity once the fever settles. As with most viral illnesses, ensure your child remains well hydrated by giving plenty of fluids. There are a few scenarios in which you should seek medical opinion, including if this is the first time your child has a febrile seizure, if your child is less than 18 months old, if the seizure lasts more than 5 minutes, if the seizure is only on one side of your child's body, if the pattern of the seizure is different from the usual febrile seizures your child has had before, if your child is not responsive for more than 20 to 30 minutes after a seizure, if your child is unable to move one side of his or her body after the seizure, or if your child has had more than one seizure within 24 hours. If you encounter any of these scenarios, you should bring your child to a doctor. Well, in summary, here are the key points to remember about febrile seizures. Febrile seizures occur with fever and are common, and the occurrence of a febrile seizure has not been shown to be associated with the height of temperature. If your child has a febrile seizure, stay calm and place him or her in a safe spot. We hope that you now feel confident to look after your child with febrile seizures. Don't forget to bring a pamphlet home as well. Remember, if you need help, Feel free to ask.